Hi, my name is Jennifer Robinson, and I will be discussing coronary atherosclerosis today. The objectives for this course is going to, upon completion of this unit, the student will describe the pathophysiology of coronary atherosclerosis. The student will be able to describe the mechanism of action, drug interactions, and safety regards to the HMG-CoA reductase inhibitors, also known as the statins. The student will be able to describe the risk factors associated with coronary atherosclerosis. And finally, the student will be able to describe preventive measures related to coronary atherosclerosis. The learning environment is a community college classroom with 80 students, adult students with varying ages and varying educational levels. However, the student must be at least 18 years of age. Assignments in preparation for the class was to read Hinkle and Cheever, chapter 27, and also read Wells, chapter 8. Coronary atherosclerosis is the most common cause of cardiovascular disease in the U.S. Cardiovascular atherosclerosis is an abnormal accumulation of lipid or fatty substances and fibrous tissue in the lining of arterial blood vessel walls. Pathophysiology of atherosclerosis. Atherosclerosis begins as monocytes and lipids. And lipids enter the intima of the injured vessel. This is when the smooth muscle cells proliferate within the vessel wall and develops fatty accumulations and atheroma. As the plaques enlarge, the vessel narrows and the blood flow decreases. The plaque may either rupture and a thrombus might form, obstructing blood flow, or produce complications according to the location and degree of the narrowing of the arterial lumen, the thrombus formation, and of the obstruction of blood flow to the myocardium. Angina pectoris is secondary to myocardial ischemia. The HMG-CoA reductase inhibitors, again, are also known as the statins. The drug class, again, is the HMG-CoA reductase inhibitors. Mode of action, what we want the statins to do is to lower the LDL-C. The LDL-C is the low-density lipoprotein. It inhibits the enzyme HMG-CoA reductase in the liver. Interactions with the statins are the gemfibrozil, warfarin, erythromycin, and niacin. Efficacy is the first-line treatment for patients with elevated risk of ASCVD. And the safety adverse effects include myalgia, the myopathy, the possible rhabdomyolysis, and the hepatotoxicity. Average cost, $15.90 on average from goodrx.com. And what we are wanting to expect with the statins is to lower the plasma cholesterol levels for all types of hyperlipidemias. Risk factors. The risk factors that are non-modifiable risk factors are going to be family history of coronary artery disease, increasing age, gender, race. The modifiable risk factors for coronary artery disease are going to be your hyperlipidemias, cigarette smoking, tobacco use, hypertension, diabetes, metabolic syndrome, obesity, which is rising here in the U.S., and physical inactivity. Prevention, preventive measures rather, is controlling cholesterol abnormalities. There are a few ways that we can control cholesterol abnormalities. One is changing the diet. One that is a highly recommended diet is the Therapeutic Lifestyle Changes diet, TLC diet. Also to increase physical activity. If you cannot do a lot of exercising or increase activity at the time, starting with 5 minutes a day and then increasing from there could really help controlling cholesterol abnormalities. Lipid lowering medications can also control the abnormalities, cholesterol abnormalities. Promoting cessation of tobacco use is big. We need to provide our patients with ways and information and resources to promote cessation of tobacco use. Managing hypertension is also big with preventing coronary artery disease. Controlling diabetes also is something that we can do to control and prevent coronary artery disease. Evaluation. What we are going to do is do a post-unit quiz that must be completed prior to leaving the classroom today. The post-unit quiz will see if the students have met the objectives that we have discussed today. There will also be a non-interactive case study that will be completed after class and turned in the following day via Blackboard Dropbox assignment portal by 8 a.m. Outcomes, the outcomes that I am wanting are the students will meet all learning objectives, and as evidenced by a score greater than 85% on a post-quiz, the quiz we just discussed, and the completion of the case study. The references for the presentation are here. And do you have any questions currently? Or if you cannot think of any questions currently, we have our discussion board and Blackboard. Send questions so that the class, your peers, can participate and we can discuss online. Thank you for your time, and I appreciate you listening today.